Hi guys, my topic for today is regulatory compliance in the healthcare settings, Chapter 9. Risk management professionals should not take lightly the complexity associated with providing healthcare services. While regulations, third-party payers requirements, and licensing or accreditation standard contribute to this complexity, formalized policies and procedures can mitigate it by promoting workplace safety, regulatory compliance, and the delivery of safe, high-quality patient care. Moreover, well-written, up-to-date policies and procedures reduce practice variability that may result in substandard care and patient harm. The purpose of policies and procedures. First, facilitate adherence with recognized professional practices. Promote compliance with regulations, statutes, and accreditation requirements. Example, HIPPA, EMTALA, CMS Condition of Participation, DNV Joint Commissions. And it reduces practice variation, standardized practice across multiple entities within a single health system. Serves as resource for staff, particularly new personnel. Reduce reliance on memory, which, when overtaxed, has been shown to be a major source of human errors of oversight. Problematic policies. When a domain unknowingly develops a policy or procedure that already exists, perhaps another domain issued a similar policy earlier. There will likely be differences, resulting in confusion as to which policy should be followed. Discrepancies in clinical policies may also result in allegations that leadership allowed two levels of care to be provided, thereby increasing the organization's risk exposure in several ways. Definition of terms. There is little agreement among healthcare regulators, accrediting bodies, and provider organizations about the definition for terms such as policy, procedure, and guidelines. The use of word policies throughout this article should refer to policies, procedure, and guidelines. The following definitions are based on the author's experience. First, policy statement. A concise statement outlining the context, goal, or purpose of a specific procedure. A statement that is a guide to any decision making in relation to process or activities that regularly take place or might be expected to occur. Second is procedure. The desired intentional action step to be taken by specified person to achieve a certain object in a defined set of circumstances. Third is protocol. Synonymous with procedure, often used when describing clinical patient care-related interventions. For example, a chemotherapy protocol or the Joint Commission Universal Protocol for preventing wrong site, wrong procedure, and wrong person surgery. Next is guideline. Recommended action for a specific situation or type of case. A clinical practice guidelines could, for example, outline blood testing practices for patients who are taking anticoagulants. Anticoagulants. Allegations may include a nurse or physician's failure to adhere to policy, corporate negligence on behalf of hospital that failed to adopt appropriate policies, adequately train the staff with regard to these policies, implement them, or evaluate how they are used. The policy was inconsistent with the standard of care. Policies the organization had in effect were contradictory to the other organization policies, differed across entities in the same system without a basis for the difference, or were inconsistent with applicable regulations. The following example illustrate problematic and preferred phrasing within a policy statement. What is the standard of care? The standard of care is not established by any single objective resource. It is culled from the testimony of experts with similar knowledge and training as the defendant and who have testified at trial about the facts of the case. Problematic EMTALA policy statement or EMTALA policy statement. The federal government passed the Emergency Medical Treatment and Active Labor Act or EMTALA in order to require hospitals to offer treatment to all persons who seek care. They also passed this act in order to prevent patient dumping when a hospital refuses to treat or transfer a patient to another hospital such as financial reasons. Preferred EMTALA policy statement which precede a detailed procedure. The procedure below is intended to promote compliance with the Federal Emergency Medical Treatment and Active Labor Act, its amendments, regulations, and reporting requirements. Disclaimer statement. Each policy should include a disclaimer statement to remind the staff members that they must use their judgment to determine if all parts of the policy and procedures apply to each situation or whether uh, typical disclaimer statements include the following, which should be approved by legal counsel. The policy statement is intended to describe the reason why the associated procedure has been issued and to explain the context for it. Procedures are resources to assist staff in carrying out specific actions. Procedures do not specify all circumstances to which they apply. Procedures cannot, in themselves, guarantee safety. Safety is promoted by the people being skilled at judging when and how, and when not, to adapt procedures to local circumstances. Next is clinical situation may warrant adoption due to unique patient characteristics. Extenuating circumstances may also necessitate adaptation. Professional associations practice guidelines. When developing or updating clinical policies, the first step is usually to identify whether pertinent professional association have published practice guidelines on the subject.